Hello, everyone. This is Ian Robertson from Ian Robertson's Therapy Group. Today, I got the privilege and the honor of doing our first kind of co-led podcast with Constantino Tolber. I just want to first of all begin. I was pretty excited to have you do this with me, and I wouldn't have had it with anybody else.
Excited to be
Constantino, let me tell you a little bit about the background. Constantino works at our agency, but he's a very impressive young man and dynamic. He has a master's of clinical mental health counseling from Niagara University, and he holds a bachelor's of art in psychology at Medaille University in Buffalo, New York. Hey, Medaille's closed down now, eh?
Oh, yeah.
Yeah, it's closed down, and I guess it got consumed by Niagara University.
My now alma mater, Niagara University.
Right? Yeah, and your only one, right?
And my only one. And the best one.
Right? There you go. Yeah. Constantino lives in the Niagara region, and he's been offering psychotherapy. This is actually his first year of kind of completing, private practice at our agency. And I guess it's the first year practice in general for you, right?
Sure is, yeah. Yeah, after my graduate degree. Yeah.
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 Constantino, some areas that I think you are quite interesting is you're interested in trauma, you're interested in areas of mental health, anxiety, depression. You're interested in definitely dealing with grief and loss. You're also interested in a bit of sports therapy too. Constantino is an extensive athlete. He's an NCAA dual sport athlete, and he's a member of the Hungarian national lacrosse team, but he's also an accomplished soccer player, and both of them are at high levels, sports performance. Right? Am I correct on that, John? Constantino?
Correct. Yeah. In the NCAA, played soccer, played lacrosse, and then
wow, that's so impressive.
Thank you.
So,
a student athlete.
Yeah. Constantino also has done a little bit of work in the criminal justice system, and he's worked in specifically under the clinical supervision of a very well accomplished clinical supervisor, right? Who has specialized in this area of practice. And you've done a lot of work in supporting individuals and families in that whole process of restorative care. You've also have done some work with the postdoctoral research from the University of Notre Dame in psychotherapeutic curriculum development, which is really super cool. Another area that you've done practice, just to kind of brag about you, because it is pretty impressive, is that you were contributing as a pioneer study on mental health and resiliency amongst some military personnel in a specific area of military kind of clinical practice and military well-being and military readiness, specifically for soldiers, first responders, and astronauts coping with trauma and high stress. So really such an impressive amount of work you've done for such a young fellow. Congratulations.
Oh, thank you very much. I worked very hard in my graduate studies to, try to have the most impressive CV I could for when I graduated.
Well, you know what? You've nailed it. You've nailed it.
It's good to hear.
So Constantino came to our agency, and originally on paper, I when I first saw your CV, I thought, he's too young. And I remember saying it to other people here that reviewed your CV with me, and I said, I don't know, he's kind of young, doesn't have a lot of experience, right?
I don't blame him.
So no, for sure. And so then I said somebody else interviewed you, right? And all of a sudden they came back and says, you got to see this guy, like he just was stellar in the interview, right? So met you, and I knew right then what a great fit. So it's so nice to have you here, Constantino, for kind of our first kind of co-led podcast, eh?
Well, it's an honor to be here. Yeah.
Yes, well, it's a privilege for us. So, a year afterwards, you've been in practice for a year. We thought maybe a good place to kind of do our first podcast with you is exploring what your first year as a new therapist has been like for somebody new in a career, like doing private practice. So maybe a good place to begin is kind of just reflecting on, hey, listen, when you look at your first year and you look back, hey, what have been your takeaways? What are the things that are kind of learnings for you? what are the things that have kind of opened your eyes in terms of practice as now being somebody who's you're not an RPQ anymore. You're an RP.
That's for sure. Yeah.
Yeah. So hey, I'll give you the space and let's kind of explore that together.
Yeah. Well, in your first year, I think that you're bound to, have ups, and you're also bound to have downs, and like just like we preach to our clients, consistency and staying steady, resilience and being reliable. I mean, the same principles sort of go for ourselves too,
Yeah.
and being understanding with ourselves and taking the good as it comes, taking, learning lessons as they come.
Yeah.
My first year's been challenging, it's been exciting, it's been stressful.
Yeah.
Like at times, right, I've learned how to become a real sort of true professional, or I'm learning, right?
Yeah.
Passion, focus, compassion, empathy, like, kind of honed in on these skills. And, I'd say I learned a lot of, in the first year about number one, clients, theory and what works, and number two,
Yeah.
like about myself as well. And what do I bring to the table, as a therapist?
Hey, well, listen. Tell me about what did you learn about yourself? That's a great place to start, I guess, too. Right?
It's a great place. That's a great question. Like, I think that, but the best way to, describe myself, every therapist has their own unique, way of giving therapy, you
Yeah,
know,
for sure.
Yeah, and every therapist is a one-on-one. Like nobody, truly gives therapy like you do. And my style is, I'm a relational therapist, and also a person-centered therapist, I would say, meaning that, uh, number one paramount cornerstone to therapeutic progress, is the relational experience for the client, right? And how comfortable, how safe, and how much of a connection and how much of a relationship can you build, with the client themselves. And so that's above all things as a therapist, that's what I'd say. And I would hope that that's the way that my clients, sort of describe me as well, right? So
Well, that person centered approach
yeah,
to therapy. I mean, that's really that whole concept evolved out of you know Carl Rogers, right? And Rogers, to some degree, really believed that if I could listen to the emotions, if I could listen to the experience at a deeper level behind the words, that just by being an effective listener and being able to understand with empathy and give language to a person's experience behind the words they're sharing, that was extremely powerful, validating. It really helped for people to kind of feel some sense of forward movement, forward direction when they could sit with somebody who could sit and be such an effective listener. And I mean, I think what you're talking about is not just kind of listening. You're really talking about that person-centered empathic listening, which is really trying to use reflective listening that has the complexity and the ability to really, really see a person at a deeper level, even in ways that they might not have been able to language or see for themselves as you kind of reflect that back.
the client themselves is the expert, right, in therapy, and that's one of the main sort of principles that I've learned in my first year. I was kind of thinking about this earlier today.
Yeah,
You described, that I've had really great, mentors, right? Uh, Early on in my master's,
sure.
program and throughout, and I'm very, very fortunate for that. Very. I think, however, that like my greatest ever teacher really is the client
Yeah,
themselves, right? They're the ones that they teach you about their experience, what they know to be true, what's going on for them, and the really the workings of their inner world and their inner experience. And we're just there, I think, as therapists to help them become better experts, of their lives. And I've had clients bring me in books, that I hadn't seen before, that I'd seen for the first time, and I thought, wow, this is what like incredible sort of information,
yeah.
so really they're the teachers, and yeah, I appreciate your insight there too, Ian. Right.
Well, and I think here's the challenging question,
Yeah.
right? Where 100% being client centered is really allowing the client to lead the process, right? And so many of our clients have been, you know, unfortunately into relationships and situations where power was used over them, compliance was used over them, and states that didn't allow them to actually feel the collaborative and empowering approach of being able to make decisions and explore and those types of things. So now, in terms of that, I'm going to ask the $1 million question. What might be the limitations to it, too?
Well, um, that's a great question. What are the limitations of uh, a person-centered approach?
Or, because I think it's interesting, your style has been great in the first year. Love the way approach, and clients really connect to you. And so when clients come, the person centered approach is again really driven on the idea of having this empathic presence that can begin to see the client in ways that they may not even be able to see themselves, and in reflective listening communicate that back, deepening that you're with them, there's attunement, but deepening it, the experience, so that they're actually able to see these parts of themselves that they might not have noticed.
I think that there's a balance. One potential danger is over empathizing with the client. Like that could be
Yeah.
dangerous,
How
right?
so?
Because
That's
then,
a great point.
yeah, well, you tend to miss stuff. And it's also a
Mm.
countertransference. And then you get out
Yeah.
of the role of therapy and into the role of like advice giving, right?
Yeah. Yeah.
Which is you're not really giving therapy anymore. So, the
Yeah.
empathic side, the person-centered side is great. Anything taken to the extreme could become also a vice too. So something to also
Yep.
be watched and to be aware of. Yeah.
Really good insights.
Yeah.
The other thing I think is interesting, I don't know what your thoughts on this, but I'm just going to throw it out. You know, um, what do you think the limitations are for people for the self to see the self?
Limitations for people to see the self.
Yeah, so the self, what is the limitations of the capacity for the self to actually really see the self?
Well, the self hasn't yet discovered the self. I think often that's what sort of leads people to therapy.
You're
Uh,
right.
I it's kind of a process sometimes, like in trauma, where it's almost like you're introducing people to themselves. You know,
Yeah.
uh, um, so I think that again maybe ties back to this person-centered idea and how good are we at
Yeah.
exploring issues with clients,
Right.
sitting with clients in the uncomfortable, where
Yeah.
often there's time for psychoeducation, validation of feelings, processing, which are all very valuable.
Right.
um, two for therapy and helping them to discover the self and sitting. And then that's where our sort of clinical skills come in too, as far as how, I mean, I'm huge on systems, right? Systems approaches, and building. I mean, this work really at the end of the day is about building bridges
Yeah.
and understanding clients, right, where they're at. So I
Well, and
think
I
it's a,
also,
yeah.
yeah, and I was wondering about, and I think where I was going with this too is the idea of it's kind of easy to be, to stay in kind of the logical part of the brain, but be very disconnected to the mind body connection, to where you notice, you know, experiences in the body that maybe you might not want to connect to or may not have any connection to. And so that whole thing with the idea of how far the self could see the self, it's kind of one of the reasons why, in the earlier days, the psychotherapists, the forefathers of psychotherapy believed that you needed an observer, somebody else,
Yeah.
because the self is only the conscious awareness self, which is, kind of the cortical areas, but most of bonding and, painful events that couldn't be integrated and traumatic experiences, all of those live in the part of the brain that is unconscious, subcortical, and not conventional memory can't actually access it. Right. And so I guess that whole thing around how far can the self see the self? And so how do you see your role is being able to explore that as the observer of the client that helps them see what they can't see within themselves
Yeah.
as they start using this person-centered approach, right? Which you're doing very well, right?
Yeah.
How do
And
you open up
hopefully,
that for clients?
hopefully what you do too, I think, is that you help the client once you could step out as a therapist and help,
Yeah, right.
serve them, that you're helping them after then, that they could step out and become an observer and assessor of
Nice.
themselves and their lives. And in order to do that, you need to have an understanding of the client as well. And then I think that
Yeah.
you could apply the theory and the modality and the practice and
Yeah.
the tools. Maybe what you're talking about
Sure.
goes back to a little bit of polyvagal theory,
Sure.
and
Yeah.
connecting with the body and the somatic sort of experiences, which can be done and integrated when you have an understanding of the client. And so I have a mental image of the therapeutic relationship being like the universe.
Yeah.
And
Okay. How so? That's interesting.
yeah, the core of it, like the sun,
Yeah.
is the relationship that you have with the client.
Yeah.
And then the modality, the theory, the practice, all the things that you learn in school, uh, like the arc of traditional psychology, emotional, like all that, that's all like orbits, like kind of, you know, planets that sort of orbit around, if that makes any sense, right? And
Sure.
there are things to be integrated in pieces once you have this kind of core established. Then you can pick and choose, where do I apply this? Where do I apply this? What might work?
Yeah.
Right? That's case conceptualization. That's the beginnings of case conceptualization. And so, yeah, that's what I mean by that.
Yeah. I guess when you're thinking about that, using that analogy of the universe and things circulating around it, right? Um, from a client's perspective, what might those things be for them?
Yeah. Well, a process to be worked on with the client. Um, I don't truly know it,
Yeah.
and I wouldn't necessarily guess to know. Um, Hopefully, they're concepts that you arrive at, like with the client, together at the same time, because your job isn't to tell the client which planets, in my analogy, to pick.
Yeah. Yeah. Yeah.
It's to help guide them that they make that decision, right?
Yeah.
So, yeah.
And I guess part of that comes down to a little bit too, is when you talk about being able to kind of be with and hold space with a client, it's also being able to read how their nervous system is responding to yours, right? And so therapists that just stay as cognitive therapists are really not attached to the neurophysiology of a client's experience as they sit with you. And I don't know, I think that the neurophysiology, the neural system, is actually creating the majority of our clients' perceptions and experiences before the conscious awareness brain even knows, right? And so that whole sitting with you, with your nervous system, how does that interaction happen between, and what's your thoughts on that?
Yeah, the calmness that you give and that you present as a therapist always transmits to the client. Like, I use an example of maybe a client who's been suffering from ADHD, you know, um, a certain tone, a certain calmness, and a certain demeanor will help them to downregulate, and sort of settle out their nervous system. And they, can leave the session feeling a little bit calmer, and a little
Yeah.
bit better, but there's always sort of an interplay between
Yeah.
the nervous system of you and that of the client. And people want to come in and see a therapist that they feel to be calm,
Yeah.
steady, a steady presence, you know, and somebody reliable and so on. So yeah.
Yeah, I think too, because I think many of our clients' nervous systems are wired with a bias towards survival and fight and flight and fear and freeze.
Yeah.
And their nervous systems aren't wired to feel the sense of connection. And, I think for many of our clients, that was broken down in early development, right?
The brain inherently has a negativity bias, which is how I kind of explain it to clients. Um, Now, like we also have that too as therapists, and that speaks to how are we able to manage our countertransferences
Yeah,
and
right.
when sessions don't go the way that we think, that
Yeah.
we planned, that we wanted them to go. How adaptable can we be, you know, to meeting the clients where they're at, right? Growth and
And
change is complex, and it doesn't always take the expected course of action.
yeah, yeah, for sure. And
Yeah,
our ability to have an open heart
yeah,
to
yeah,
those experiences,
yeah,
right? Because part of that goes down also to the role of repairs,
yeah,
right?
yeah, yeah,
Yeah, great conversation. Sounds
yeah.
like you've learned a lot in a year.
Well, I do a lot of thinking. That's what's
Yeah, yeah,
important.
yeah,
Yeah, yeah,
yeah. Well,
yeah,
and I think you're also highlighting you're doing a lot of thinking, but you're also doing a lot of connecting to yourself too. Because
yeah,
in order to connect to your clients, you know, a therapist that's not integrated themselves is going to have a difficult time
yeah.
working with clients. And so that whole self-integration, I think what you're saying is the calmness, the having a nervous system that's calm, having a nervous system that's not in any activation, and bringing that calmness to the session so that the client has an anchor, a hook to co-regulate with, where they can also feel that. And that's got to be like, I don't know, it's probably powerful as a felt present experience for clients.
For us both. For us both. Yeah. You know, just like the clients go into fight or flight, like we do too, you know,
100%.
as therapists. And when that happens, like our perspective tends to narrow. We get tunnel vision. Like,
Right.
in other words, the fight or flight sort of response.
Yeah.
Our perspective shifts and we go into defense mode, you know,
Yeah.
which could be sort of have dire consequences for therapy and for the relationship, for the progress. Staying attuned to what you're feeling like on the inside in sessions
Yeah.
is a little bit, it can be a little bit exhausting, but a
Yeah.
very necessary part of therapy, to ensure, you know, also integrity for the client as well, right? And safety for them
Hey,
too.
how do you manage that within you? Because you are right about one thing. Where you can't do that, you'll have, as Freud would say, unmanaged countertransferences and projections onto the client. So how do you actually manage that for you? Because you're human. Your nervous system goes up and down when you sit with it, right? How do you actually do that?
Well, I think what I point back to, the main thing that I point back to is awareness, you know, because without awareness, you can't do anything, right?
Yeah.
So I think awareness is really the cornerstone of it. It's very human to have reactions. It's not that I judge myself,
Mm.
that I think we as therapists are, that makes you a bad therapist for having a countertransference.
It's
Not,
normal.
it's
It's
normal, yeah,
inevitable and it's normal.
and it's human, yeah,
And it's
you
human.
know, yeah, and so number one, I don't, when something comes up for me, I notice it. Otherwise, like, how can we deal with something when we're not able to notice it? Uh, so that's the first step is awareness. Now,
Yeah.
with the awareness comes the tools, right?
Yeah.
And then the stitching that puts it all together is then how do you implement the tools and how do you use them with clients, um, in terms of not personalizing, you know,
Yeah.
and looking at anything that the client says is information and an opportunity to grow, right? And uh, should be appreciated, you know. So I could share a real great story if that's
Yeah, as long as it doesn't have identifiers, it's not connected to any clients from here. Yeah, sure.
yeah, both are true. It was in my internship a long time ago.
Oh, okay. All right. Well, as long as there's no identifiers.
No identifiers. Long, long time ago, before I was able to manage my countertransferences.
Yeah. Okay. Oh, sure.
Yeah. So I'd done a number of sessions. I was some background and some context. I was seeing clients in probation and parole, right?
Yeah.
Men mainly. And I'd seen a fella for maybe like 10 sessions. And, this gentleman, what we'd done was mainly CBT
Yeah.
based. Like I was really excited to use some of the concepts and the theories that I was using in school
Hmm.
and to begin trying to apply
Yeah.
them.
Yeah.
And so excited about it. And we had what I thought was a good sort of relationship between
Yeah.
this gentleman and I. One day he comes into the session and he sort of says like, "Hey, Constantino, I don't want to see you anymore. I want to see a psychiatrist
Yeah.
so that I could get CBT, right?"
Oh.
Yeah. So
eh,
how I reacted in the moment was human. I
Yeah.
had your reaction is like,
Yeah. Yeah. For sure.
"Wow, he said that." And that was my gut feeling,
Sure.
and I sort of said, a psychiatrist is not going to give you CBT, and I don't think that that's a very good idea, right?
Yeah.
Now, if that came up now, I would respond in a much different way, right?
Yeah.
And after doing some supervision on it, after thinking about it for a little bit,
Yeah.
I realized that the client sharing with you that they want to do CBT is, I mean, what better news can you ever get as a therapist,
Sure.
right?
Sure.
And it was an
Yeah.
opportunity for growth. And I actually approached it in the following session. I actually apologized, right?
Right.
And I said, hey, look, it was very powerful when you said that you wanted to learn about CBT. We began to do some psychoeducation on CBT. Uh, what is
Yeah.
it? I explored with him what led you to it, what was interesting about it, how did that
Yeah.
connect to the presenting issues,
Yeah.
and then we began to take a look at the CBT that we were already doing, and
Right.
how can we, how can we make our sessions and our time together a little bit more meaningful,
Sure.
and guide the therapy a little bit more. Two very different responses, the first to the
Right.
second. And the only difference was, in one, I was able to manage my countertransferences, and the other, I
Yeah.
wasn't. Right?
Yeah. Really good. I want to tell you,
Yeah.
um, you do know countertransferences don't know degrees, and they actually don't even know years of experience. Right? It's whether you're from the highest level academia to wherever, where there is where there is life and breath, there will be countertransferences because everybody has some degree of history and some degree of lived experiences, and all those live again unconsciously, and they get touched with any reminders, right? Like, what would you suggest? It's interesting because I got asked to go back to Nag University to teach a class for social work. Did I tell you?
You mentioned it. Yeah.
Guess
Yeah.
what subject on?
What?
Count-
Countertransferences? Golf?
yeah, I had an interesting conversation over email with the prof from the school, and then yeah, it
Yeah.
was good. Yeah, like we talked about, it's not actually taught in most schools anymore.
Yeah.
Most schools are just teaching about kind of theoretical frameworks and practices and these types of things, right? But this has become kind of a lost art, and you know and so I think it's slowly coming back because when we look at the work of especially working with trauma, one of the most key important components that we have to trauma is managing our CTRs and all of the conscious and but unconscious. There's more that's happening below consciousness between the clinician and the client, where a lot is being discussed, but really what's being discussed is not what's really happening underneath within that transference and countertransfer dynamic. So, I think it's great that you're exploring that, and it's a never ending journey, right? How do you work on that for you? Or, it's kind of because the more we can do that, the more we don't necessarily, we're going to have them, but we're able to manage them better so that we can be more present with the client.
Yeah. Yeah. Managing them, I think, is all about awareness without judgment.
Yeah.
The same sort of things that we say
Yeah.
uh, to our clients. I think that any countertransference taken to the extreme, or when sessions don't go right due to a countertransference,
Yeah, for sure.
it could usually be pointed back to there was a lack of awareness, you
Yeah.
know. Oh,
Yeah.
I didn't know, right? I didn't
Yeah.
realize that I felt that way on the inside. So I'm
Yeah.
I'm I'm, I'm in session. I'm constantly checking in with the client. I'm
Yeah.
also constantly checking in with myself.
Yeah. Good.
Yeah,
What are you checking in for within you? What are you looking for?
feelings. Yeah, feelings and emotions. You
Yeah.
know, which are
And
very. Yeah, sorry.
no, no, go ahead.
Okay. Yeah, which are very different for each client and each presenting issue. For example, a client that comes in that's grieving, I might leave the session feeling a little bit more heavy, like it's more of a heavier
Yeah.
sort of in a sadder sort of
Sure.
sort of feeling that I get on the inside that you have to be aware of, which ties back to what we'd originally talked about,
Yeah.
being over empathizing, you
Right.
know. So that's an example of how important it is to be aware of a countertransference, right? Whereas an intake session, constantly thinking, I'm constantly, I'm a very systems based
Right.
therapist. So I'm constantly, thinking of patterns and different things that connect
Yeah.
with one another, which can be a little exhausting and make you feel a little bit stressful on the inside, right? So, what I'm saying is I'm constantly sort of checking in with what's going on,
Yeah. I
with
mean,
it.
I think you're raising some great points because, it's funny when you bring up empathy, right? Because that's kind of one of the things that's drilled into everybody that's in our industry in academia. But people aren't actually explaining the risks of it too. Like, so one of the countertransferences that can happen with clients is that you over empathize. And that's called a countertransference two. And countertransference one is your avoidances, right? And so, you know, I think anytime we start to over, empathize with the client, not only is that kind of trying to work out your stuff through the client, but it's also leading to, high empathic strain.
Yeah,
It's high emotional labor output, high empathic strain, which then eventually leads to a rupture, right?
yeah,
Or can lead to ruptures, right? And
yeah.
so, you know, all of those things are things I guess a new therapist needs to understand or learn. Um,
And
I mean, oh yeah, go ahead.
and then if I speak to another area, it's how do you take care of yourself as a therapist? That's another thing
Yeah,
that we learned. Also ties back to countertransferences because, like, and it could be exhausting what you're describing, that the
yeah,
emotional strain,
yeah,
right? Being aware of your countertransference is actually a way to, I think, take care of yourself as a therapist and
yeah.
protect yourself. Yeah.
How to good? I mean, tell me if you had to make some recommendations to, new people coming to field. How should they take care of themselves? Like, what does that look like?
Yeah. I mean, we all have different I wouldn't necessarily use a blanket term, like, and say this.
Hmm.
We all have different approaches and different things that we know works for us. What works for me is, like, as you know, I exercise a lot,
Yeah,
and
that's good. We like that, by the way. Here,
you do too.
we want mind body health here,
Yeah,
100%.
yeah, it's all integrated, So I know you use your Peloton and stuff, which is awesome, you
Yeah,
know. So, taking care of my physical health is huge for me.
good.
uh, want to make sure that I'm, feeling, nice and healthy and strong.
Yeah,
Um, I'm mindful of how do I schedule clients. I would say that, you know, uh, I know my limits. I try to practice knowing my limits.
yeah, yeah. Okay,
Uh,
good.
if I have a harder kind of session that I know is going to be harder, I'll schedule it earlier in the day
Yeah,
sometimes when
smart. Yeah, sure.
I'm more fresh. So these are just small kind of tips that I have
Yeah,
picked up.
yeah,
Yeah,
yeah.
yeah.
I also think some things that I think in this career, and these are just my thoughts around it, but I think good therapists have therapists, right? And that whole role of, part of taking care of yourself, there's the emotional side that we have to take care of, the physical side, right? And we have to have our own ways of being able to take care of our mind and slowing that down and really giving attention to that and, our nervous system and, like we've talked about breath work and all that. But I also think too, just the role of getting the supports that you take in a lot and how do you also make sure that you're also accessing your own supports around that and other supervision and things. It can be working, Like, I mean, if you had to give advice to a clinician, because this is isolating, you do work very alone. And so what might be the risk if you talk to a new clinician? What might be the risks around what self-care looks like, especially when a lot of it is in aloneness?
Well, you know, what's really important is to have the right people around you.
Yeah,
Supervision is critical,
huge.
you know, uh, just like we help clients observe what they can't see, our supervisors
Right.
help observe what we
Yeah.
can't see. And like you said, there's no, age like limit like on that.
Yeah.
Important for everybody, right? And it's a practice I think that you develop individually on your own,
Yeah.
what works best for you.
Yeah.
For me, it just so happens to be regular exercise. My dog, right? Big one.
Yeah. Yeah. What's your dog's name?
Her name is Lucky, and she
Oh,
just,
her.
yeah,
Lucky. Okay. How
and
come you
she
haven't
just,
brought her to the office?
I have, when you're not there. I'll show you. Yeah, she's coming after hours a few times.
Oh yeah,
Uh,
yeah. That's pretty good. Is she calm?
do you know what? We're having her trained to be a therapy dog.
Oh yeah,
Yeah.
you should bring her in the office. You should have her in with your clients, unless you have somebody who's like phobic of dogs or something.
Unless,
You know,
yeah,
coming in.
therapy
But
tales, it's
yeah,
called. So she'd
yeah,
be a
that's awesome. Good for you.
she's 9 years old,
Yeah,
and she's a diva, but she's feisty too.
eh,
So
that's
yeah,
awesome.
and
Well, oh, go ahead.
she loves peanut butter. That's all I was gonna say.
Oh, she does.
Yeah,
Her, you know my favorite food, right?
peanut butter.
100%. This actually might be a problem between me and your dog,
Yeah,
right?
into
So,
some fights.
uh, well, listen, a couple of things just closing out too. I just want to just kind of touch one more thing for, new therapists. That how would do you have any recommendations for new therapists around how do they continue to grow their skills? I'm thinking about the idea of ongoing development and what does that look like for new therapists? Sometimes people just get their degrees and they just, some cases they stop
Yeah,
learning, right?
yeah.
But if you had to make some recommendations, what are your thoughts around that, Constantino?
Well, what we need is to be constant learners.
Yeah,
What I've seen, the best therapists in the field are ones that are constant, lifelong learners. And I think that it's an alignment of number one,
yeah,
mind, wanting to learn the new modalities and the new theories and the new
yeah,
practices, staying up to date, all that stuff. Very important. It's an alignment of that and also of heart, right? Where you
yeah,
actually genuinely want to help and you care. And if you have those two pieces, you have the makings of a good therapist. It's just paramount to,
yeah,
uh, always like continue to want to learn. Like we talked about earlier, the client is the best,
yeah,
teacher.
yeah,
Always taking in information, learning from clients, learning from your experiences, reflecting on
right.
sessions. What are your goals as a therapist? If your goals are to grow and to become better and then it's just something that you have to do, in my opinion.
Yeah,
Yeah.
good for you.
Thank you.
Yeah, really, really good.
Yeah.
Well, if we summarize the key points from today, just from our little chat online here, what are our key points for the new therapist? What would you highlight the key points?
Key points for nutrient therapists is managing your countertransferences. Uh,
Okay. Hey, can you
oh,
explain that? Because I'm just thinking about this. We've been talking about this. I don't actually know if people would know what you're talking about.
yeah, yeah. What are countertransferences?
Yeah, yeah,
Yeah, maybe a way to describe it is um, uh, anything that goes on in the session that makes you yourself as a therapist stress, right? That could then sort of impact the
yeah,
session, right?
yeah,
So it's being present and being aware with yourself.
yeah.
That's how I go. Yeah. So
Yeah, so I think also, like, I mean, just to expand on that
yeah,
is, and this is where I think therapists, you know, we need another person to help us with that. Therapists,
right.
in social work, they use a term use of self, which is an okay term, but it also makes the assumption that the self can see the self. And the majority of the brain is actually not conscious awareness, but unconscious. And that's exactly why, like, our forefathers, Freud, Jung, all those ones, Donald Winnicott, all those people really talked about the idea of needing an observer, because all of our history still lives in the unconscious. And anytime there's a reminder, with, experiences that are shared by clients, you can get activated.
Yeah.
Right.
Yeah. I agree totally, and I think that the most important thing for a new therapist, a new therapist that you're coming in, is supervision, number one.
100%.
Not just because you need it to fill your criteria
Yeah.
for your college, but because it's important for you in order to
Yeah.
grow.
Yeah.
Number one. Also, be teachable, be coachable, be open to
Right.
learning.
Right.
Right. Have lots of coffee. Right.
That should speed up the nervous system. Yeah.
Right. And take care of yourself is the
And
last.
take care of yourself. Yeah.
Right. So, and that's true for any profession, by the way, not just being a therapist, but in any field. You need to be coachable and you need to be teachable. NFL players say the same thing. It's a pillar to success. So,
that's awesome. Constantino, it's been like a total pleasure to kind of do our first podcast together. I was also thinking too, we're going to do one more that we've talked about that I'm kind of interested in. And I've been starting to kind of post a little bit on blogs and stuff like this. But I'm loving the conversation because so many therapists are like worried about ChatGPT and getting replaced by AI,
Yeah.
And, so a lot of the trainings that I've done, I hear this anxiousness around, what's going to happen with AI in therapy, right? And I think it's a great conversation. So we're going to do a podcast. We're going to be doing it at the end of the month, you and me.
Okay.
And we're going to look at, hey, listen, let's look at AI. Let's look at AI in the healing process versus therapy, And we're talking about, we might just have chat in the podcast with us, and let's see if we can, kind of between you and me, separate the difference between, what's the difference between AI as a method of resolving problems, and how does that differentiate from therapy? And we could also maybe ask some good questions to chat to see how smart it is from a therapeutic perspective. Let's see what it comes up with. Hey,
Yeah.
what are your thoughts?
Live demonstrations.
So it'll be you, me, yourself, Constantino, myself, and one of the other kind of participants will be ChatGPT.
The trio of us.
The trio. It'll be great. Hey, listen, thanks so much, Constantino, honestly, for taking the time. I mean, this is outside of your work hours for sure, but for sharing your experiences. It's been really valuable to kind of, for you to open up your inner world experience as a therapist and what that's been like for you. And, especially kind of your insights that you've brought and your real learnings. And your learnings are quite, they're profound and very deep. And especially your genuineness to want to see clients, your genuineness to want to allow clients to feel that sense of empowerment to lead their journey. You're genuine to say, like, I don't want to get in the way of your process. I want to just walk alongside. And your ability to kind of be so person-centered, as like Carl Rogers, right, brought in terms of our approach. So all of that, you're a gift to us. We appreciate you, and I'm really super stoked that you are our first person that we could kind of share some time and talk about your lived experience. So on saying that, thank you.
It's been a real pleasure. Thank you so much, Ian.
All right. Listen, you have yourself a great day, and I can't wait till February comes for our next one.
I know. Good. Stay tuned.
You take care, Constantino.
Take care.
Bye-bye.
Bye.